Hello and welcome back. I'm Dr. Amy Novotny, and I'm here to talk to you today about your balance and how it has to do with how you breathe. When we think about balance, we typically think about, are we strong enough to hold ourselves up? Do we think about our visual system? Do we have good vision that helps us maintain our balance? Because that's very important. There's also a system called your proprioception system, which is your ability to sense where you are in space. So sometimes if you have an ankle injury, a sprain, or a fracture, your sensory cells in your ankle have a hard time telling your body where it is in space. And so if you walk on an unstable surface, your balance might be a little bit challenged just because those sensory cells haven't developed that skill again to tell your body where you are in space. Another part of balance is your vestibular system. So in the inner ear, we have these canals that have fluid in them, and that fluid touches on hair cells when we turn our head. And our eyes need to catch up with our head movement to help us keep balance. Sometimes that gets off as well. So that's typically what you hear about when someone talks about balance. How can we improve those areas in our body and in our physical skills? But you don't hear about is your breathing. And so I want to talk a little bit about why your breathing mechanics and how you breathe actually plays a role in your balance. So when we think about breathing, we hear the word diaphragm. So it's a muscle inside our torso that goes up and down. When it goes down, you're inhaling and you're pulling air into your lungs. When it goes up, you're exhaling air out. Now, when you really have an optimized diaphragm, your ribs are down in front and your rib cage is like a cylinder. It's very stable. That allows your breathing to be very efficient, allows your nervous system to be calmed down. But then what often happens is we're taught to suck our gut up and in and pull our shoulders back and have this rigid core and straight back. Well, that actually takes away from our balance. And the reason it does that is because when you suck your gut up and in, your lower ribs flare out, which decreases your ability to use your diaphragm. And when you lift those ribs up and out, your back muscles kick in, which makes you more rigid. And so in order to accommodate that, your body weight changes and shifts towards the front of your feet. So now you have most of the weight on the ball of your feet, or you can have other compensations on top of that, but it changes your balance. And so what people often do is they turn their feet out to help. They widen their stance or widen their gait so that there's a big space between their legs to improve their balance, all because they've lifted up their ribs, arched their backs, changed their breathing mechanics, and now their balance is compromised, so they have to have other strategies to improve balance. So what you can work on is getting the ribs down in front to support the diaphragm, so when you exhale, your breathing actually calms your nervous system down, releases muscles that were guarding and not working properly, so now your muscles can learn to contract and relax. So when you need them, they can contract, and when you don't need them, they relax. So your breathing helps with calming your nervous system to allow the muscles to hold your balance, but changing your breathing mechanics helps you not overuse your back muscles and get your rib cage back into a cylinder so you're more stable. It gets a little complicated, and I know that was a lot that I just said, but it can really help you. And I do this with people with Parkinson's disease who have just balance disorders, and people just in general who have lost sense of balance because their body has shifted so much into this military posture where they're sucking their gut up and in because they were told to do that at some point in time in their life. So I challenge you, start looking at how you breathe, change the way you breathe. And if you need help, reach out. You can reach out to me, Amy, at paberinstitute.com, PABR-institute.com, and we can go over it. I work with people on Zoom all over the world and teach them this information and help guide them on their process. So check it out. Please try it out and get in contact with me. And talk to you later. See you next time. Bye.